If you remember, last time we were talking regarding mixed infection. So sometimes there is only the causative agent of one disease is one microbe, and sometimes in some disease two or several microbes are present. And accordingly, sometimes only one antibiotic is not sufficient. And maybe a physician should use a combination of different antibiotics to suppress them. So we told that mixed infection, several microbes grow simultaneously at the infection site. For example, when one person going to the fire or burned skin is a port of entry for many microbes in the hospital, and mostly there are mixed infections. We have two different types of infection. One is primary infection. Primary infection is the infection which starts with first pathogen. Sometimes one pathogen starts infection and it follows with another one. If you remember, for example, Entamoeba histolytica. As its name shows, entamoeba, it is an amoeba, which its place of activity is enteric or intestine. Histo means cells, intestinal cells, and lytica means lysis. So as its name shows, if by water, drinking water, or by eating vegetables, cysts of this amoeba can reach to our intestine, this cysts change to trophozoites. What is the difference of cyst and trophozoite? In protozoa, cyst is similar to spore in bacteria, and trophozoite in protozoa is similar to vegetative state in bacteria. So trophozoite is a form of bacterium which it grows and multiplies and attack or produce toxin in our body. Cyst is a resistant form of protozoa, not eating anything, not growing, and not multiplying. So if we receive cyst of Entamoeba histolytica in our intestine, all cysts change to trophozoite, and Entamoeba histolytica trophozoite can attack to the intestinal wall with bleeding, and diarrhea, and mostly with dysentery. So what is this? This is a primary infection. It is a primary infection. But when in our intestine a pathogen can attack to the intestine, accompanying with bleeding, so now normal flora can go through the bleeding, can go to the blood, can go to the vein, and normal flora in its place, in their place. They are normal flora. So in blood, in lung, in liver, in kidney, in brain, in heart, we don't have normal flora. Any microbe can go out of intestine, can go to the inner parts of intestine, can go to different parts of the body. Now it is not normal flora, it is pathogen. So when Entaubiostolytica attack to intestine, it is primary infection. But after some time, many bacteria can go there also, and they have problems there. So now secondary infection. Secondary infection. Another infection by a different microbe. Another infection by a different microbe. So primary infection is by Entaubiostolytica, and now not protozoa, but many bacteria which they are another infection by different microbes is started. Yes. Entaubiostolytica is anaerobic parasitic amoebozoan, part of the genus Entamoeba, and predominantly infecting. Yes, correct. Or for example, another infection like Leishmania tropica. Leishmania tropica by help of sandfly. Sandfly are injected to our skin. So as Leishmania produce leishmaniasis. Leishmania produce leishmaniasis because Leishmania tropica like the coldest part of the body. Where is the coldest part of the body? Skin. Skin is the coldest part of the body. So Leishmania tropica remaining in the skin, not going to the deeper parts of the body. Because of this, we call it cutaneous leishmaniasis. We call it cutaneous leishmaniasis. Means leishmaniasis related to the skin. Yes, and it has different names like Lahore sore, Aleppo sore, Baghdad sore, and etc. So it is primary infection. When signs and symptoms on our skin after biting of sandfly start, it is because of the primary infection by the Leishmania tropica. But after some time, normal flora of skin can penetrate the place of infection also. So primary infection is by Leishmania tropica, but this infection is followed by secondary infection, by another infection, by different microbes, by different bacteria, and this second one is secondary infection. Secondary infection. Warning signals of disease. So we understand disease according signs and symptoms. What are they? Signs and symptoms. Sign. Objective evidence of disease as noted by an observer. For example, when a patient is in the hospital or patient is in a physician's office, so a nurse or a physician or lab worker can find something about the disease. Objective evidence of disease as noted by an observer. Okay? For example, by doing blood culture, we do blood culture and we notice physician there are many bacteria in the blood. So patient cannot understand bacteria are there. But observer, lab worker, nurse, or physician, by doing different tests can understand it. Okay? So it is signs. But sometimes we are talking about symptoms. Symptoms. Subjective evidence of disease as sensed by the patient. So when you have disease and you go to physician, you have something to say. For example, you go to physician and you tell him or you tell her, I have headache, I have vomiting, I have sore throat, I have abdominal pain, I have heart attack. So you have something to say. The patient can understand some symptoms. And physician can understand something more than symptoms. We call it signs. So patient understand many things, explain it. Physician can approve symptoms and can understand something else which patient doesn't know. Yes. For example, one patient says, I have heart pain. It is a symptom. But physician tell her 60% of heart veins are blocked. So patient cannot understand how much percent of the veins are closed. So it is science. Physician understand, lab worker understand. By the person is working, getting brain scan, getting different, using different devices, can understand many things about the disease. For example, symptoms, patient can understand chills, pain, ache, soreness, irritation, nausea, malaise, fatigue, chest tightness, itching, headache, nausea, abdominal cramps, anorexia. Patient tell the physician, I cannot eat anything. I cannot drink anything. So it is symptoms. Sore throat says, I have problem in my throat. So they are symptoms. But physician can use thermometer, can understand how much is the degree of the fever. Patient says, I am warm. My temperature is not normal, but physician by device tell it is 39 or it is 40 or it is 41. Or by lab test, physician understands septicemia, the presence of bacteria in the blood. Or physician can understand the presence of microbes in the tissue fluids. For example, doing aspiration, 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 when you can get many samples from the body of the patient. One sampling is by, we say, biopsy. When you use a scalpel, it is a special knife of surgery, okay? From a small part of the tissue. From live person, it is biopsy. You put it on a slide and you can see it by the microscope. Mostly it is done by the pathologist. Sometimes after the death of one person, we want to do it, so we call it autopsy. We call it autopsy. Okay, it can be done by a needle or with razor blade. You can get a small piece of tissue. Sometimes you use syringe and you receive some liquids of the body. For example, you can get CSF. What is this? CSF, cerebrospinal fluid. So it is liquid. It is not solid. So you can get it by syringe, and sometimes you check it, the presence of any microbe. You want to know, is it any microbe there or not? Patient cannot understand microbe is in CSF or not, so it is not symptom. But if it is, physician and lab worker can understand it. So it is signs of the disease. Okay. Chest sound, so by device, physician can understand the chest sounds, the skin eruption, leukocytosis, the number of leukocytes in the blood, leukopenia. We explain it in the next page, leukocytosis and leukopenia. Sometimes leukocytes are more than normal or less than normal. Swollen lymph nodes. You know, lymph nodes have a critical role for immune system, and sometimes during infection, lymph nodes are swollen, and they can be seen by eyes and armed eyes. Physician can easily look and feel them by finger. Abscess. So we explain it in the next page. Abscess, the presence of bacteria and immune cells. The reservoir inside the tissue between bacteria and immune cells. Okay, take biopsy from tumor by surgery. Yes, one biopsy is done by tumor, but it is not only for tumor, because sometimes the presence of tissue parasites. sometimes there are some tissue parasites. So how can we find them? Sometimes by serology, and sometimes by biopsy. So biopsy is not only for tumor, understanding the presence of tumor. It is done, but sometimes biopsy is done for understanding the presence or absence of some tissue parasites in the body. Like what? Like, for example, Trichinella spiralis. Trichinella spiralis is a tissue parasite. Leishmania tropica. If one person has Leishmania tropica, how can we feel it? So, by a scalpel, a razor blade, yes, we can cut a small, very, very small part of the infected skin, and we transfer those skin and blood on a slide, and then we try after staining to see Leishmania tropica. So we say this person has leishmaniasis. So patient cannot see parasites in the skin. So it is not symptoms, but lab worker and physician can see, can observe them, yes, by microscope. So it is signs: abscess, tachycardia, increased heart rate, antibodies in the serum. So patient cannot understand how much antibodies are present in the serum. So it is not symptoms, it is signs. And as much as antibodies are more or less, it is a key, diagnostic key for understanding the situation of infectious disease. Don't forget that in this semester, regarding to this course, regarding to the advanced bacteriology, when we are talking about disease, we mean infectious disease. As I told you, we have two different types of disease. One type of disease is infectious disease, like those infections which causative agent is a microbe. For example, if you know one person has COVID-19 and he is sitting in a room, you like to go outside, or you request him to go outside. Yeah, why? Because you know it is easily transmitted by air from one person to another person. So it is infectious disease. But some diseases are not infectious. They are not infectious disease. Like what? Like diabetes. If 20 people have diabetes and are sitting in a room, so you go there and you sit there. Why? Because you know diabetes, thalassemia, and migraine, and many other diseases are not infectious disease and are not transmitted from one person to another person. Okay? So anytime in this course we are talking regarding to disease, we mean infectious disease. We don't talk anything about non-infectious disease. Syndrome. Disease is defined by complex of signs and symptoms. So physician check all signs and symptoms, and sometimes they are very complex, and some signs and some symptoms are common for different infectious disease. So it is very critical and it is very important that one physician, by signs and symptoms and different equipment and different tests, understand the correct responsible for the disease. Because if we know the causative agent of a disease, the drug is very simply can be found in the internet. So all of us, in a few seconds, we can check in the internet which drug is suitable for interrupting and killing the bacteria regarding to any disease. The critical point is diagnosis, correct diagnosis by the physician, because sometimes there are complex signs and symptoms, and many signs and symptoms are very, very similar to each other. So laboratory tests mostly are helpful for physicians to get a good decision, Signs and symptoms of inflammation. When a population, members of a bacterium in our body can persist, can attack to our body. So in this place, there is a war between immune systems, different cells, different antibodies, and those bacteria. There is a war. The place which the war is between bacteria and immune system, it is inflammation. Earliest symptoms of disease as a result of the activation of the body defenses: fever, pain, soreness, swelling. So if there is fever, its responsible is immune system. Fever. You know, the parasites, bacteria can adapt the gross temperature similar to the human temperature, 37 degrees centigrade. So the best temperature for growth of all pathogens is 37 degrees centigrade. So our body knows it very well. So when an infectious agent can come inside our body, our immune system elevate our body temperature to 39 or 40, sometimes to 41. So the temperatures above the 37 degrees centigrade is helpful to suppress the growth of the pathogen. But anything is useful when it is under the control. So if for a long time our temperature remaining above, it can be life-threatening. Okay? All the things can be helpful but under control. So if one patient has fever, it is a response of immune system, and it is response of our body in front of the pathogen. Why? Because pathogen maximum growth and multiplication is in 37 degrees centigrade. But when the temperature going to 38, 39, 40 degrees centigrade, the growth and multiplication will be minimum. Growth and multiplication of the bacteria, pathogenic bacteria, will be minimum. And when there is a war, there is not only with one groups of attackers. See, when bacteria, pathogenic bacteria come in our body like a war. So air force, land force, different forces are coming for war, yes? So immune system, neutrophils, macrophages, antibodies, temperature, all the things which they are effective, they are coming in groups to attack to the pathogenic microbes. The another thing is pain. After any infectious disease, according to the place of presence of the pathogens, there is pain. So we don't like pain, but pain is helpful. Why? Because, for example, I give you one example. For a long time, when a person have cancer, doesn't have any pain, is it good? So when one person doesn't have pain, there is no alarm. Without alarm, the person never go to the physician. Without going to the physician, never start therapy. And when the pain starts, it is late to do anything. And most of the cancer people, if understood earlier, could continue their lives for a long time. But why they died sooner? Because they understood it late. So pain, or some people, nervous system in mouth and teeth is very weak. When there is infection in their teeth, they have pain very late. When they go to dentist answer, you came late and you cannot have this tooth. I should remove it. But the patient tells, only a few days back I had pain. So the physician says, you had pain in late time. So fever is good because it is helpful, but under control. Yes, after sometimes we should reduce it and we continue by antibiotic therapy. Yes, I don't tell fever is good and you try to make it as much as higher. No. So at the start of infection, fever stop the infection by fever, but immediately we should reduce it and we help the body. We help the immune system by antibiotic therapy. Pain is good. Why? Because pain is look like alarm. Your car is in the street, alarming. So immediately you go, not allowing a person take your car. So alarm. You are going and working outside, and after some time, which you are in front of the sun, by sun radiations, your face will be red. So when you see yourself in the mirror, you understand you should have a hat, or you should not allowing sunlight coming to your skin. because after some time, maybe the person going through a skin cancer. Soreness. Sore, for example, sore pain or any pain in our sore throat, in our throat. Sometimes it is streptococci, Streptococcus pyogenes. If during a year more than 3 times we have sore throats, pain in this place, this bacteria is responsible for production of some antibodies, which those antibodies can attack to our heart. So we should not allow repeated many times soreness. Swelling. Sometimes the place of presence of bacteria is swelling, and we can see and we try to remove it. Signs of inflammation. Sometimes according or during the inflammation there is edema. There is edema. What is edema? Edema is accumulation of body fluid in one place of the body. Sometimes it can be in our foot, sometimes it can be in our hand or in any place, according to the position of presence of bacteria. Edema, accumulation of fluid in body causing swelling, as leg and hand we can note it. For example, in this page you can see it is edema. Yes. If you put your finger in a place of edema till many minutes, your finger point remaining there. Yes. So it is very easily we can understand the presence of edema. Another thing is granuloma and abscess, walled off collections of eliminate cells and microbes. It is granuloma. You can see here granuloma. So bacterial cells and immune cells, it is a war. It is a war in the location of presence of pathogenic bacteria, lymphocytes, epithelioid, histocytes, multinucleated, giant cells, and many bacteria. So what is this? This is granuloma. It is a collection of immune cells and a type of chronic inflammation. Granulomas are made up of specialized immune cells, including lymphocytes, histocytes, multinucleated giant cells, different immune cells, as well as bacteria. Why do they come here? They come here for war against the enemy. Pathologists use the word granulomatous to describe the microscopic look of granuloma inside tissue. So it is not cancer. Yes, it is a place of the war between bacteria and immune cells. How can we see that? We can see that by biopsy. Yes, by biopsy. When our sample is related to the tissue, it is biopsy. If it is come according to the liquid sample of the body, like CSF, now it is aspiration. Another thing, and abscess, if the lesion expand to the surface and some, you can see it is a skin and presence of pathogenic bacteria as well as immune cells. In the war, those killed bacteria and those killed immune cells make pus, white blood cells. So this pus can reach outside. If the pus and bacteria can reach out in the infected area, now it is abscess. It is abscess. If it is located inside the tissue without reaching outside, it is granuloma. If can reach outside, it is abscess. Abscess, you can see this liquid, this pus can reach outside. So granuloma and abscess. Lesion. What is lesion? General term for site of infections or disease. So what is lesion? Site of infectious, site of disease. It is a region in an organ or tissue which has suffered damage through injury or disease. So any place of the body which after infectious disease suffered problem, suffered damage, it is lesion, such as wound, ulcer, abscess, tumor. So all of them we call as lesion. Signs of infection in the blood. Sometimes the pathogenic bacteria can reach to the blood. Suppose one person has a skin burned and he is hospitalized in a clinic. So some bacteria like Pseudomonas aeruginosa are multiplying in the skin, but sometimes they can go to the blood and they can remain there. So in the next page, I tell you what's happening. If bacteria are present in the tissue or present in the blood or present in any place, mostly the number of white blood cells are more than normal. So by getting a sample from blood and after staining, we can easily see the blood. You can see those cells without nucleus, they are red blood cells, and the other bigger cells with nucleus, containing nucleus, they are white blood cells. After you are experienced, very easily you can understand this smear contain low white blood cell count. And here, left side smear is high white blood cell count. Different cell, monocyte, T cell, and eosinophil, and the others. Okay? So right now, changes in the number of circulating white blood cells. Changing in the number of circulating white blood cells. Number one, leukocytosis. What is leukocytosis? It is an increase in the white blood cells, left side, yes, this one. It is leukocytosis. It means you have a high white blood cell count. This means you have more white blood cells than normal. Leukocytosis is a normal immune response. So normally after any infection, the number of leukocytes are more than normal and isn't always a cause for concern. So after finish the infection, after some time, again they come to the normal. Most of the time, it means that your body is fighting off infection. Sometimes this large number of white blood cells show maybe infection or inflammation finished. Leukopenia. Leukopenia is in the opposite direction of leukocytosis. Leukopenia. It is a decrease in white blood cells. So here there is a decrease in white blood cells. Low white blood cell count or leukopenia is a decrease in disease-fighting cells or leukocytes in your blood. Leukopenia is almost always related to decrease in certain type of white blood cell, mostly multinucleated white blood cells or neutrophils. The definition of low white blood cell count varies from one medical practice to another. So physicians should focus why white blood cells are more and why white blood cells are less. What happened? Signs of infections in the blood. As I told you, sometimes some bacteria, some pathogenic bacteria can remain in the blood, can multiply in the blood, can go everywhere in the body by help of the blood. So we call it septicemia or sepsis. It is septicemia or sepsis. Septicemia or sepsis is not regarded only to bacteria, any microbes, because as I told you, only upper respiratory tract, on our skin, and inside intestine, there are some normal flora. The other parts of our body must be sterile. Our brain, our eyes, our kidneys, our heart, our lungs, our muscles, all over the body must be sterile. Any microbe, any bacteria, any virus, any fungus, whatever, if present in the blood and can persist and can grow and can multiply, the person has septicemia or sepsis. Microorganisms multiplying in the blood and present in large numbers It is the clinical name of blood poisoning by bacteria. It is the body's most extreme response to an infection. So it is very dangerous. Because you know, our veins in our body look like the roads in the country. If all roads are stopped, or if all roads of a country to be in hands of the terrorists, so it is very dangerous. If now in our body pathogenic bacteria are terrorists, so if those pathogenic bacteria by blood can go everywhere, they can go to liver, they can go to brain, they can go to kidney, they can go any place. It is very dangerous. The person is close to die. If one person has septicemia, if won't be cured soon, he will die. Sepsis that progresses to septic shock. So mostly people suffer septicemia getting septic shock, has a death rate as high as 50%, depending on the type of organisms involved. What is the type? Some microbes are stronger and some microbes are weaker. Stronger and weaker are depending on the virulence factors. Which virulence factors they have? Some bacteria produce exotoxins, some cannot. Some have capsules, some not. Some have special pili, some not. So according which types of virulence factors are present in the bacterium, if the bacterium, the pathogenic bacteria are strong, kill the person. If they are weak, maybe after antibiotic therapy, again return back to the life. Sepsis is a medical emergency and needs urgent medical treatment. Yes, because no need patient asking anything from you, because patient is in a very bad situation. So bad, which without any asking, you take him to the hospital. What can we see regarding to the sepsis? So sepsis. The person which has sepsis has shivering, fever, or very cold. Sometimes fever, sometimes very cold. E. Extreme pain or general discomfort. Worst ever. P. Pale or discolored skin. S. Sleepy. Difficult to wake up. And confused. When you ask what is your name, he cannot respond and answer you correctly. Yes, confusing. And cannot walk, cannot stand. I feel like I might die. When he can tell something, he says, I'm going to die. He feels he is very bad. S. Short of breath, cannot easily normal breathing. So they are some signs in the sepsis. So it is a very bad situation which we can see in the patient. But sometimes we have bacteremia. Bacteremia and sepsis have some similarities and some differences. What are the similarities and what are the differences between bacteremia and sepsis? Similarity is bacteremia and septicemia are the presence of pathogenic microbe in the blood. It is the similarity. Presence of bacteria in the blood. It is bacteremia and it is sepsis. But what is the difference? In bacteremia, they are in low number and immune system can suppress them very soon. And the patient don't feel bad because all bacteria immediately are killed by immune system. But in septicemia, pathogenic bacteria in the blood resist in front of the immune system, remain in the blood for a long time, multiply, they go everywhere. So it is the difference between bacteremia and septicemia. Small numbers of bacteria present in the blood, no multiplying because they are low number and very soon are killed by immune system. They don't have chance for multiplication. They don't have chance for multiplication. It is caused when bacteria are present in small numbers and removed rapidly from the bloodstream with the help of immune system. If viral infection can reach to the blood, we call it viremia. Viremia, like bacteremia, viremia. When viruses enter the bloodstream, some common or well-known causes of the viremia include different viruses. If we have different infections with different viruses, such as those are listed here, they can come to our blood, like HIV type 1, 2, influenza virus, viral pneumonia, viral meningitis, varicella zoster. No need to memorizing all the names, but don't forget many viruses can reach to the blood and can makes us in problem because very easily can go all over the blood, all over the body. But the main difference between viremia and bacteremia is that in viremia and septicemia, the main difference between viremia and septicemia is that in septicemia, all the pathogenic bacteria present in the blood can multiply, but in viremia, all viruses present in the blood don't have any multiplication because viruses are obligate intracellular parasites. They are obligate intracellular parasites, and they can only multiply inside the cells and not all the cells, the target cells. For example, hepatitis virus should go to the liver, or another virus have specific sites. Rabies must go to the nervous system. So viremia are the presence of viruses in the blood. Septicemia are the presence of bacteria in the blood. But in septicemia, all the pathogens can multiply in the blood, but in viremia, blood is only a device for transfer from one part to another part of the body. and they don't have any multiplication in the blood. Okay? Unless the target site to be blood. Unless the target site to be blood. Infections that go unnoticed. Sometimes we have a definition with the name of asymptomatic infections. Asymptomatic. We have two types of infection: symptomatic infection and asymptomatic infections. In symptomatic infections, there are many signs and there are many symptoms. So you go to the physician and you have many things to say. You have many things to say. When it is symptomatic, you say, I have headache, I have fever, I have so and so and so. Okay? But in asymptomatic infections, pathogenic bacteria are present in your body, but without any symptoms. You cannot understand their presence. So in epidemiology, it is not good. Why? Because when one person has symptoms like pain, like those problems, he goes to the physician and going through the therapy, and accordingly trying not to infect the family, not to infect the people. But when one person has asymptomatic infection, the person doesn't know he has any disease. The person doesn't know has any infection. So going through the people, going through the family, and mostly can infect them without understanding it. For example, in this photo, you can see transmission of asymptomatic COVID-19 patients. Sometimes one person has COVID-19, but it is asymptomatic. When it is asymptomatic, it doesn't know there is no transmission. There is transmission from one person to another person. Even though it is symptomatic or even though it is not asymptomatic. Because of this, sometimes you ask first people, why don't you use mask? He says, I don't feel any problem. I don't have disease. Sometimes maybe you have an infection without any symptoms. So it is asymptomatic. So this person can transmit the infection in the hospital to the other people, can transmit to the people in the city, can transmit to the family, and then if it is asymptomatic in your body, it doesn't mean if transmitted to another person, again, it continues as asymptomatic. Maybe it changed to the symptomatic forms, So asymptomatic infections we call as subclinical infection. Clinical infections are those infections which you have something to say. Clinical infections. Subclinical, you don't understand it. You don't have anything to say. Although infected, the host doesn't show any signs of the disease. In apparent infection, person doesn't seek medical attention. Yes, when the patient doesn't feel any pain, any fever, anything, so doesn't go to physician and doesn't use any medicine. In epidemiology, these people are bad because without knowing they have infection, they transfer infection from one person to another person. Latency. What is the meaning of latency? Microbe can periodically become active. Microbe can periodically become active, produce a recurrent disease. So sometimes you have a disease, you go to physician, you get drug, but again repeated, not new infection. The previous infection again starting after some time. It is recurrent disease. We call it recurrent disease. A latent infection is an infection that is hidden, inactive, or dormant, as opposed to active infection, where a virus or bacterium is actively replicating and potentially causing symptoms. Latent infections are essentially static. Latent viral infections in human include herpes simplex, varicella zoster, Epstein-Barr virus, cytomegalo, adenovirus, and so on. So sometimes if one disease not new, the previous one again repeated. So immune system don't kill all, some remaining, and again after some time show their problems. And the last thing we tell you, and we finish this lecture, it is sequelae. Sequelae. Long-term or permanent damage to tissue or organs. So if a microbe is present for a long time in our body, we call it chronic infection. If one microbe can be present in our body for a long time, we call it chronic infection. When one pathogen is present in our body for a long time, can have damage to our tissue and organs. A typical sequelae is a chronic complication of an acute condition or long-term effect of temporary disease or injury which follows immediately from the condition. Like COVID-19 is also known to cause post-acute sequelae known as long COVID, post-COVID syndrome, or post-acute sequelae of COVID-19, you know, when for a long time COVID-19 can be working in our body, attack to our lung, attack to our kidney, attack to our heart, attack to our brain. So they are damage to our tissues and our organs. Okay? So we finished page 37. Please next week, don't forget, remind me to start page 38. If there is any question, please ask me. If not, we can say goodbye till next week, the same time. Thank you so much. Thank you for your presence. I hope you have happy days with your family. We meet each other next week. Thank you very much. See you. Goodbye.